Gentlemen, congratulations to Sunway Medical Center, Sunway City, on the official launch of the first photon-counting CT system in Malaysia.
Now, as a nation, we are at a pivotal point in our health reform journey. The Ministry of Health is building the foundation of a system that is future-focused, future-ready, hopefully future-proof as well, a system that is digitally enabled, data-driven, and centered on early detection, personalized care, and stronger population health outcome. And I've pledged and I vouched to do this, and already we are coming back the second time, as they say, second bite to the cherry. I really want to make sure that you will have a healthcare system, both system and delivery, worthy of a Madani government and your citizenry, so that we'll be able to truly, exemplify a healthcare, beyond just acute sick care. So that will be the way we want to go. Hence, we have just recently launched our plan strategic pendigitalan, our strategic plan for digital health, 2026-2030, and together with the National Health Interoperability Platform, and our shift towards finally an overarching, purpose or objective of a value-based healthcare. We really want to ensure that Malaysia now transition from the episodic care to precision-driven continuous health management, and this is truly the value-based healthcare that I vouch to deliver in at least for the next 2 years in this 15th parliamentary session. And technologies that enhance diagnostic clarity and accuracy will be really essential to this evolution. Yeah, this transformation becomes even more urgent as we confront the burden of disease, of cancer, cardiovascular diseases, the chronic respiratory conditions, and as we very well know, the number one premature death killer in Malaysia is still IHD, followed closely by lung, by pulmonary, and the rest of it. So you having this truly would be a great help. Now, the rising burden of cancer, cardiovascular disease, chronic respiratory condition, and realities of a demographic transition into an aging population and aging society will all demand for a more modernized, if I may use that word, care model and delivery model, which must now be put in place. And the future of healthcare will depend not only on treatment, but on how early and how precisely we can detect diseases. And all these cutting-edge technologies are really making it all possible. Yeah. Now, ladies and gentlemen, within this national agenda, innovation plays a defining role, and advanced diagnostics are no longer an option. They are almost foundational to enabling early intervention and strengthening clinical decision making. And imaging technologies that we are now seeing that reduce radiation exposure, these are very low radiation, by the way, improve precision or clarity, enhance tissue differentiation are key to achieving a better outcome for patients. So patient journey is so very important, and patient experience, and especially their unmet expectation all this far. Yet, technology must be complemented by strong partnerships, and Malaysia's healthcare ecosystem is at its best when public and private sectors work in synergy. The Ministry of Health welcomes public-private contributions that elevate standards, expand capacity, and introduce capabilities that benefit the entire nation. The spirit of shared purpose is essential to building a system that is resilient, modern, and truly centered on the well-being of all Malaysians. Against this backdrop, today's milestone stand out as significant and both significant and timely. Sunway Medical Center is now the first hospital in Malaysia to introduce photon-counting, computed tomography, the PCCT, your neotome, alpha model, and as a next generation innovation that I've just said and alluded to you earlier. Now, this has been well elaborated by Dr. Adam earlier, and I also want to make a mention that up to 50% lower radiation exposure is offering safer scan for pediatric patient, chronic patient, and those requiring repeated imaging. That's where it's become higher risk. So you have even congenital heart diseases follow-up will be truly amenable to all this technology. Yeah, and of course you've shown that from cardiovascular imaging, oncology, neurology, pulmonary and infectious diseases as well. So all the range. Yeah. So these advantages translate into greater diagnostic certainty and more informed treatment pathways that make it all the more pertinent to have at least one in Sunway to represent all of us in Malaysia for the time being.
Thank you so much, young Ahmad, Datuk Seri, Dr. Dzulkefly Ahmad, for making the time and effort to join us here at this